In recent months, the University of Chicago community has risen to meet a challenge without modern precedent. The global COVID-19 pandemic has affected all facets of our society, our campus community, and each of us as individuals. Now, we look forward to welcoming as much of our community as possible back to campus for the autumn quarter, guided by the university's academic missions and values, and in close collaboration with public health experts and the University of Chicago Medicine. Our approach is also informed by federal, state, and city public health guidance. Our return to campus will require the commitment of our entire community as we rise to a new aspect of the pandemic challenge. I am grateful that you are part of this effort and pleased to share this overview of the university's plans for the autumn quarter, including the health and well-being practices we are implementing to help keep our campus safe and build a culture of collective responsibility around the public health issues that we confront.
For those of you who are already part of our community, I know that being away from campus for the past several months has likely been difficult. If you are new to the university, I'm sure this is an unexpected way to start your experience here. We have been working diligently to create an environment that prioritizes our health and safety while fostering the intellectual, cultural, and social life of our university. Everyone who returns to campus will be required to complete a brief training and uphold the UChicago Health Pact, a reflection of our collective responsibility and obligation to care for each other and protect our community's health and safety. The pact includes wearing a face covering on campus, maintaining appropriate distance from one another at workspaces, self-monitoring daily for symptoms of COVID-19, washing hands frequently, adhering to quarantining requirements, and more. We plan to hold in-person and remote classes for autumn quarter, allowing us to bring back as many members of our community as possible, while adhering to public health guidance around social distancing and other measures designed in an effort to prevent the spread of COVID-19. Most classes will include a remote component. Some will be conducted fully remotely, and others will include a combination of in-person and remote instructions and discussion. For in-person classes, we have reconfigured classroom spaces to facilitate social distancing. We will also implement new cleaning and ventilation protocols in accordance with federal, state, and city public health guidance. The last week of instruction for the autumn quarter, as well as reading and finals periods, will take place fully remotely to help minimize the chance of an increase in COVID-19 cases between Thanksgiving and the end of the quarter. To promote a safe living environment, occupancy for residence halls will be significantly lower, and dining halls will have reduced seating capacity and focus on takeaway meals. We know that formal and informal gatherings are an important part of university life. Gatherings on campus will be limited based on guidance from the City of Chicago and State of Illinois, as well as university-specific factors such as overall density of the campus at a given time. We are committed to facilitating meetings, performances, exhibits, social activities, and other events in our adapted environment in strict accordance with our health and safety requirements. We'll share more soon about student activities, UChicago Arts, athletics, and other programs in autumn quarter. Our research community has already begun the process of bringing researchers back to campus. In the first phase of this process, which began June 15, we have been encouraged by the early implementation of health and safety measures. As we monitor COVID-19 trends in the region and move to the next phases of recovery in Chicago and Illinois, we will consider moving into the next phases of the gradual expansion of on-campus research. For the time being, any research that can be done remotely should continue to be done so. Workplaces will use the same strategies, including mandatory face coverings, reduced density, require social distancing, and enhanced cleaning and sanitation as those implemented across the university. Since remote work serves as a critical element for maintaining the appropriate density of people in university spaces, many people will continue to work remotely or follow a combination of remote and in-person work. For everyone returning to campus, it will be important that we remain vigilant yet flexible to adapt to new ways of learning, teaching, researching, and working within the new health and safety protocols. Rigorously examining issues and solving hard challenges are what we do best at this university. I'm confident we'll prove that once again as we confront the pandemic and the changes it has brought to our lives and to our campus.
The COVID-19 global pandemic has created challenges for all of us, none greater than that faced by hospitals. Here at the University of Chicago Medicine, we've assembled a team of experts to help us address the challenges of taking care of sick patients and protecting vulnerable healthcare workers. In the process, we've learned some amazing and valuable lessons about how to protect people from COVID-19. And we are going to use those tools that we've identified here to help everyone across the campus to be safer. In partnership with our public health organizations, the CDC, and experts at the hospital, as well as the experts at the university, we are preparing to bring many of you back to campus as safely as we can. We know that no single intervention is going to be sufficient to help protect us. And that's why we plan to stack together multiple interventions in order to knit together a safety net that will protect us as best we can. Universal masking will be absolutely essential, and more distance with decreased density of human beings and a lot more space between you in classrooms, and mandatory testing for people living and working in residence halls. We know that we can't control everything, especially things that happen off campus. And we know that some people will get sick. We're prepared for that. And we have a wonderful partnership between Student Health Services and the University of Chicago Medicine, a world-class hospital right here on campus. The one thing we know about COVID-19 is that we don't know everything yet, and we expect there to be changes. The recommendations, guidelines, and the way that things operate on campus will adjust and be flexible to any new information or changes in the epidemiology. But we know that together we can do this.
As we move forward, we must always keep in mind the values that are foundational to the University of Chicago. Rigorous, ongoing intellectual challenge in all our educational and research work, open discourse and the interaction and free expression of multiple perspectives, embracing the diversity of our community, and seriousness of intellectual purpose. Fulfilling our highest aspirations in our education and research pursuits have long been made possible through the University of Chicago community's commitment and resolve. For our unique and extraordinary intellectual environment to flourish during this pandemic, we must all honor a new set of obligations and demonstrate a shared commitment to helping prevent the spread of COVID-19. It is a privilege for me to join you in this effort. I'm confident that we will not only preserve and even strengthen what is distinctive about the University of Chicago, but also find new ways to demonstrate our dedication to our enduring values and to one another.